Hello everyone, this is Dr. Wei, OBGYN in Irvine, California. I just want to take this time to talk about emergency contraception. As everyone's staying at home to keep the COVID-19 down, it's important to know how to protect yourself from unwanted and unplanned pregnancy. Last time I made a video about how to count safe times during your period cycles as a way of natural birth control. But that's a very unpredictable and unreliable way for birth control. And unless you fit the criteria exactly, it's really not the most ideal way to prevent pregnancies. So in this time of special circumstance, what are the things that you can do? So definitely condoms is one way to not only protect you from unwanted and unplanned pregnancy, but also from sexually transmitted diseases, any STDs. And so this is by far the safest thing to do for STD protection. But it is definitely not the best way for birth control if you want a good birth control method. So what is a good birth control method in this time of need? If you are not sure, you haven't decided on something, you're not ready to commit to the pill, you don't think you want to wait that long, you don't want the IUD for that reason, so on and so forth, at least use the condoms with spermicide. However, if something were to happen, such as a rip in the condom, or you just spur in the moment and didn't have time, you do not plan to continue with the pregnancy or don't want to let this become an unwanted pregnancy, then emergency contraception or emergency pills are available. And these are called the morning after pill. There's very common ones that most people heard of that you can actually get called under the counter, or you can go to any pharmacy and you ask for it and you actually don't need an actual prescription. It's not displayed around easily accessible, but if you ask your pharmacist, you can actually get it. So the one that's most commonly known is called Plan B, B as in boy. So within 3 days of unprotected intercourse, that's when you do want to take this as soon as possible, actually. Within 3 days, it's still very effective, but the longer you wait, the less efficacious it is. So as soon as you realize, you had unprotected intercourse, go to your nearest pharmacy and get the Plan B. There's other names that are associated with it too, but then the most common is Plan B. And if you tell your pharmacist, they'll know what you're talking about. There is another one called a ELA, E-L-L-A, and that's also an emergency contraceptive pill, and that you do need a prescription. So if you call your primary care physician or your OBGYN, you can ask for a prescription called the ELA, and you can take that within 5 days of unprotected intercourse, and that is actually highly effective as well. And that one actually does not decrease efficacy-wise the longer you wait. You just want to take it within 5 days of unprotected intercourse. So remember, there are options, and these are birth control. They're not abortion pills. They're to prevent you to actually achieve a pregnancy. So for those that cannot take anything that would lead to an abortion, this is still a birth control. So hopefully everyone stays safe at home and try not to go out unless you necessarily have to. And if you have to go to the pharmacy for something like this, it's still very important, but just keep washing your hands, keep a distance. And if you have any questions, please contact us. Thanks for watching.